Good morning, everyone. Okay, so I'm Brian Castrucci. I'm the I used to be the Chief Program Strategy Officer. I'm not that anymore. I'm the President and CEO of the Beaumont Foundation. If you're not familiar with Beaumont, I strongly encourage you to go to the website. We really focus on the people, the policies, and the partnerships that we need for communities to achieve their optimal health. You can feel free to tweet anything I say. I'm at Brian C. Castrucci, and Beaumont has a Twitter as well. So what I'm going to be talking about today is the governmental public health workforce. If you care about the governmental public health workforce, this is going to be a great session for you. If you don't, you should probably re-examine your life and the choices you've made. Because we're the backbone, right? Governmental public health is the backbone of a healthy community. And so when I came to Beaumont from the state of Georgia. I was the MCH and WIC director in the great state of Georgia. And when I got here to DC and to Beaumont, when we wanted to figure out what public health was thinking, we would bring some state health officials together. Now, I like state health officials. I've worked for many. We are a partner with ASTO. However, they have a shelf life of about 3 years. Many of them come to those jobs having never actually worked in public health. And so coming out of practice, I wasn't 100% sure that was the group that should always be reflecting what public health needs. And I kind of thought, well, what about the other 99.9% of the people who work in governmental public health? So we created the Public Health Workforce Interest and Needs Survey, PHWINS, to capture the ideas, thoughts, challenges of that other 99.9% of the workforce. We first fielded it in 2014. We had about 36 states, 10,000 responses from those 36 states, and then did a local pilot that added another 10,000 respondents. In 2017, we did it again. We had 47 states, a nationally representative sample of local health departments, data from the Big Cities Health Coalition. If you're not familiar with the Big Cities Health Coalition, it's the 30 largest and most urban health departments in a membership group. And again, go to bigcitieshealth.org. And 47,000 respondents. So this really is what the workforce is telling us. And if we choose not to listen, then that failing is on those of us who are responsible for delivering training and developing this system. So these data are not about publications. They're not. I'm sadly not on a tenure track anywhere. I can be fired at any moment. Could be right now. You never know. I'll get the call. But these are about action, right? So we did publish really heavy-duty science in a March supplement of the Journal of Public Health Management and Practice, where we get into the esoteric data and science of this data set. But what I want to talk about more today is kind of like, what does it mean? And where are we going and what can we do? And so just want to give you a couple top-level key findings that we'll then dive into. First, we have really high levels of job satisfaction in this workforce, but many workers are considering leaving their job in the next year. And so we talked about the silver tsunami. Don't let that distract you. There is a silver tsunami, but there's also like a young getting out of here group too. So it is not all retirement. And I think that's different strategies for those different groups that we have to be thoughtful about. The majority of workers are satisfied with their jobs, even though the pay is not, they're not equally satisfied with pay. We'll look at that in a minute. The workers have a really high level of engagement. We're able to look at the top training needs, and the number one training need across the 47,000 folks at all levels of administration and management, so executives, managers, and frontline staff, was budget and finance, right? I'm an epidemiologist, and so I can run you a hell of a cohort study. But when I first got to Philadelphia Department of Health, and someone's like, oh, do you know the fringe rate? And I'm like, no. Do you know how to run a budget? No. Do you know my favorite? Have you looked at the CBA? And I was like, of course I've looked at the cohort-based analysis. I'm an epi. And they're like, no, the collective bargaining agreement. I was like, oh God, no. And so, again, as an epidemiologist, I was very well prepared. As a leader, manager, business person, I was wholly unprepared. And I think we all know in this room people whose careers stalled or failed for the simple sin of not doing something they were never trained to do. And so that's just something to think about as we go through the data. And demographically, we are not actually representative of the population. And so let's start there at the demographics. So looking here, we have the US workforce versus the public health workforce. We are really heavily female in the workforce, but for all of our talk of social justice and equality, we're not doing such a good job of that, even in our own health departments, right? For every 100 male workers, 4 reach the highest levels of leadership compared to 2 for women. We are primarily white. We are really, really old. Sorry, kids. 40, and now I'm going to define old, so some of you will hate me, I'm sorry. 45% of the workforce is over 50. Okay? But the problem there is only 10% is under 30. So when this silver tsunami hits, we do not have the bodies to fill. And so that's something to really, really think through. We are well educated. This gets even more so in the millennial group. The millennials are all coming out with the master's degrees in this governmental public health workforce. And so when you look generationally, the older you get, as the generations move, you're more likely to see bachelor's degrees, not as much master's, but as you get younger, the master's degree really comes up. So this is one of my favorite slides. This is intent to leave, okay? So this is what we were talking about, the silver tsunami versus this other group. And so 22% plan to retire in the next 5 years. Okay, that's your silver tsunami. Now, what's different about these data, and let's be clear about this. A lot of the data on retirement is about retirement age. This is the group saying, I am going to do it. So you can have a lot of people in retirement age and not a lot retiring, or vice versa. And so this is a better estimate of where folks really are. But then it's this 25% that really bothers me, that plan to leave in the next year for reasons other than retirement. Okay, so if you add those, that's a lot of people. That's 47%. And between 2014 and 2017, that number increased by 41%. Between 2014 and 2017, pretty much every WINS data point stayed generally the same, except intent to leave. So if this isn't, let me just be really clear. If this was physicians, we'd have congressional hearings by now. But because it's public health, we kind of just say, well, okay, that's fine. But this is a coming crisis. And again, 32% of millennials who are already representative are leaving in the next year, 34% with a public health degree, 31% of men, 24% of women. What's really important, though, is in this top 5 reasons, okay, so we really can't deal with pay. That's a different challenge. So let's just put that to the side for a second. But lack of advancement, environment, satisfaction, support, those are all within our control in a health department, in an organization, right? Are we doing the stretch assignments? Are we creating a supportive workforce? So, it's like, oh, well, I'm losing everybody to pay and I can't really, solve that problem. That's kind of a cop-out. It's kind of an excuse. So you got to look at kind of how else we can, so let's, I'm a 6', 250-pound white guy. Like, that's what I am. And so there are things like, and I'm not really fast. And so I threw shot put in high school. I didn't run because I'm slow. And so if I said, well, I'm just going to keep running and made that excuse, I don't win because I'm slow, I actually found something I was good at. We can't pay them big salaries. We're not going to compete with the healthcare systems. But we can make sure that advancement is there, or at least opportunities for stretch assignments. We can make sure that the workplace environment is solid. Job satisfaction, again, we're really high with job satisfaction. Organizational satisfaction drops 11 percentage points. We have 81% of the respondents in either the dark or light blue, 70% in the darker light blue for organizational support, and then pay satisfaction, only 48% are satisfied with their pay. Now, the good news here is that job satisfaction and pay satisfaction tend to kind of mirror each other. So see the story here. I'm really not happy with my pay, but I still really like my job. Right? So one of the questions that came was, it was in the 2014 survey, and I wasn't allowed to put it on the 2017 survey because 98% agreed with the statement, I got into public health because I wanted to make a difference. And when I said I want to put that back on, they said, what, are you worried about the other 2%? Like, who are you asking? Like, there's universal agreement there. So we have a mission-driven workforce. These aren't folks who came because they needed a job and they said, oh, I'm going to work at Walgreens, not PetSmart, or I'm going to make boxes instead of balloons. These are folks who said, I'm doing this to drive my mission. And I can fulfill the mission that I have for my life. And so we have to capitalize on that mission-driven workforce, understand that there's challenges with it. There is paid dissatisfaction, but there's a place that you can still have good job satisfaction and then hopefully advancement. But we have to be thoughtful about that. Down here, again, what's driving engagement are things like I'm determined to give my best effort. The work I do is important. So things that are more individually focused, it then drops off with things like employees have sufficient training, communication between senior leadership and employees is good. We have, again, control over that. This is the most disturbing data point I'm going to share with you today. Only 44% of the workforce says creativity and innovation are rewarded in their workplace. So you get a master's degree to then come and do some like rote assignment. So again, that's a data point that we can change if we just put our minds to it. South Carolina was part of a learning collaborative we did. That changed by 20 percentage points in like a year. It's doable, and we're writing that up. Top training needs. I think it's important that we look again. We talked about budget and finance. Beaumont has been partnering with the University of Miami to create a program called Building Essentials in Administration and Management. It's a $500 certificate course that the pilot will be launched this summer. It's been a long and arduous road to get this done and done right. But we took the time to do it, and so that's going to be available. It costs, again, $500 for people who are working in governmental public health. So systems thinking, developing a vision for a healthy workforce, change management. I mean, nothing here surprises anyone, right? So you know what we should do? Okay, so who's surprised? Raise your hand if you're surprised by this. Okay, then agree with me right now, you will stop doing assessments. Don't do any more of them. You're done. No more needs assessments, no more training gaps assessments. Just stop. Okay, because if we all agree that these are the training needs, then maybe we should actually address them instead of continuing to assess it. Again, think of like your own self. Someone diagnoses you with cancer. Well, do you just keep getting assessed over and over again? I'm going to go to another guy, get diagnosed again, and I'll get diagnosed again. At some point, you're like, I'd like some chemotherapy. I'd like to get better. But no, we keep assessing. So 47,000 people said this. This is our map. Go, do it now. Like, this is our challenge. Because if we come back in 3 years when we do the 2020 survey and we present this again and we all go, I'm not surprised, then it's on us if we don't do anything. Really important, some of the main themes of emerging concepts in public health. The things that disturb me the most here is only 43% of the 47,000 said that multi-sector partnerships were important to their work. And only 35% had actually heard of health and health policies. So again, reflecting on the training needs. Okay, this is my favorite slide. So we have learned how to say equity in the workforce. What do we do in public health? We do equity. Okay, good. What are the top things you have to do in public health? Health equity. Okay, and you see it here, 85%, right? Said that has to be involved in health equity. But then my question's like, well, how are you actually doing that? Right? Because look, 63% of you said we should be involved in K through 12, but only 53% said we should be involved in transportation. 55% said we should be involved in the built environment. 56% in the economy. So wait a second. So public health now openly says health equity is hugely important. But we have no idea how to get there. And the real mechanisms, the policies, the sectors that we have to engage with to achieve health equity, we're not sure that our health department should be involved in them. And actually, most of us don't even know what multi-sector partnership is. Okay, so let's be clear. I am here not to give bright and shiny things. So everybody go home tonight and go listen to Johnny Cash's The Man in Black, right? Because it's Shelley Hearn at City Health is doing a whole thing about a public health playlist, and I suggested I needed Man in Black. Because the whole idea of Man in Black is that when things are good, I'll get cheery and sunny again. But things aren't so good. These data are a call to action, not a call of interest, not a call of intelligence, not a call of anything else, but we got to do something about it. Because sooner or later, we're going to have to pay a bill if we don't think about how we deal with this sooner rather than later. Thank you for your attention.